welcome to my live. How are you doing today? How has been your day? I'm Adeola Adeyemi. I'm a psychiatrist and a mental fitness coach. I'm the founder of Talk Mental Health. I welcome you to my live session. Please tell me your name and where you're joining from. I like to meet you. I like to connect with you. Thank you for joining. And I'm excited about today's topic. I want to talk about smiling depression. I know that might sound a bit funny, isn't it? Depression, as we all know, that it's a mood disorder that affects how we feel, makes us feel sad. But then I'm here talking about smiling depression because I know it happens to a lot of people. I'm just here to, break it down, make you understand what smiling depression is, the symptoms, the treatment, and the adaptive coping strategies. So please, if you're joining, you're welcome. If you're just joining, if you're watching the replay, make sure you watch till the end because it promises to be an amazing one. Tell me your name and where you're joining from. I'd like to also know if you can hear me loud and clear. Okay? As I said, I'm Adeola Adeyemi. I'm a psychiatrist, meaning that I treat people with mental health disorder, depression, anxiety, and all. And I'm also a mental fitness coach. And that means I help people become better persons by teaching them how to be mentally stable, how to build mental resilience, and how to be intentional about their mental well-being. So I like to work with people to ensure they take good care of their mental well-being. So I am more of an advocate of mental health. I don't want you to wait till you break down before you get the help you need. So yeah, that's what I do basically. Okay, so welcome. Please tell me your name and where you're joining from. If you have questions, as you can see, I pinned the comments. Ask your questions. Tell me your name and where you're joining from. And tell me if you can hear me loud and clear before I start. Okay, so I just wanted to ask, has anyone ever heard of smiling depression before? Have you ever heard of the term? Or the I can't call it a diagnosis because it's not actually a diagnosis. Depression is a diagnosis, but smiling depression is more like a terminology that psychiatrists usually use to refer to people that have depression and they are trying to hide or mask the symptoms of depression. So, but I just want to know if you've heard of that before. So if you've come across the term smiling depression, please let me know. Put in a comment box and say, yes, I have. I just want to know if you're familiar with that terminology. I need to know. Kelvin from California, thank you very much. Thank you for letting me know your name and where you're joining from. And thank you so much for joining, Kevin. Please, I need to know where you're joining from. Your name, I am Adeola Adeyemi. I'm here in the UK. I want to know you. I want to meet you. I want to connect with you. And if you're not following me at Talk Mental Health, please follow me because I put out a lot of content, mental health content that can help protect your mental well-being, that can keep you mentally stable. We all know how mental health is important. And even if you don't know, you should know that mental health is very, very important. And it's one of the important things that can help you succeed in life. If you ensure that you're mentally stable, then you become more successful in life. And that's one of the reasons I am so passionate about helping people become better persons by teaching them skills that would help protect and enhance their mental well-being. So tell me your name and where you're joining from. And if you can hear me loud and clear, let me know. Thank you, everyone. So I'm just going to go straight into the topic. I can see a lot of you join. Gracie, Balogun, Amina from Nigeria. Thank you, Amina. Thanks for letting me know that you can hear me. Thank you. So I'm just going to go through it. I want to start by saying that depression is real. Depression is real, but it is treatable. The good news is that it is treatable. I don't know if there are a lot of myths. Of course, I know there are a lot of myths, but I don't know if some people are still living in denial, thinking, oh, depression is just maybe a demonic attack, or they think, oh, depression is not real. I just want to confirm to you as a psychiatrist that depression is real. I see a lot of patients every day with depressive disorder. So depression is actually real. But the good thing is that it is treatable. It is treatable. It's not the end of the world. So that you have depression or, depressive disorder or any mental health disorder does not mean that your life has come to an end. It is not the end of the world, because most of these mental health disorders are treatable. They are treatable. So if you can get the help you need early enough, if you can connect yourself to the source of help and, stay consistent with your therapy, with your medication and all those things that, that is being used to manage you, then you will get better. So it's not the end of the world. So if anyone is telling you, because you have depression, you can't go to school or you can't function well, you can't get married, it's not true. I have people that I know, colleagues that I know, that are doctors, that are even professionals, that are specialists, that are struggling with depression, and they are doing well in their respective specialties. I have clients that are, business owners, CEO, executive, that are struggling with. In fact, let me not go fast. There are some people that we all know that have depression, that have had depression in the past, and they're doing well. The celebrities and all of those actors and actresses that have had depression in the past and they are doing well. So I'm here to encourage you. So if you're watching this either on my Instagram page or you're watching it on YouTube and you think it's the end of the world for you because someone, your doctor has told you you've got depression, it is not. I just want to encourage you that depression is treatable. Mental health disorders are treatable, and it is not the end of the world for you. All you need is the right source of help. Get the help you need and make sure you are compliant or you adhere to your treatment. So that's another challenge we have. When people have, mental health disorder, they struggle to adhere to their treatment. Once they start taking treatment, they get better, they feel, okay, I'm okay now, and then I have to stop. I am here to let you know that you can't stop. You have to continue to use your medications and continue the therapy, even if you feel better immediately or, in 2 weeks or 3 weeks, some people get better. And you think that you don't have to continue to use your medication. No, you have to continue to use this medication for at least a period of time before you can be, tailed off. The medication can be tapered off or something, depending on, a lot of factors, maybe social factors and all of those. So your psychiatrist or your doctor would have to sit with you to see what best suits you and see how to tailor your management to suit you. So please, if you're watching me, if you've got depression, someone that has depression, don't be too hurried. Don't be in a haste. Don't be in a hurry. Don't be in a haste to stop your treatment. Be it therapy, be it medication. If you have complaints about your medication, they have side effects. We have a lot of medications that you can always try. You can switch from one to another. So I'm here to let you know that. So back to what I'm talking about, smiling depression. I like to let you know that depression is the leading cause of disability worldwide. Isn't that it sounds a bit scary, right? And that's why it's important to talk about this. Depression is the leading cause of disability worldwide, and it's a major contributor to the global burden of disease. It's a major contributor to the global burden of disease. What this simply means is that because when a person has got depression, it significantly impacts their ability to function. So if you have depression and you have symptoms of low mood, loss of interest, decreased energy, you're unable to think, you're unable to focus, you feel worthless, hopeless, those are the symptoms, right? And you feel you have loss of appetite, you're not sleeping well, so you're not doing well. It impacts your ability to function, whatever it is you're doing. Say you are at work and you're supposed to do something, you may not be able to go to work. You're a business owner, you may not be able to do your business well. So it causes disability. So it is a major contributor to a major contributing factor or contributor to the global burden of disease. Is the leading cause of disability worldwide. And that's why we need to know, we need to identify. Sadly, we need to identify the symptoms early and get the help we need. Sadly, when someone has smiling depression, it becomes more difficult. And I'm about to describe them, I'm about to, explain what smiling depression is to us now. So it becomes more difficult for the person to get the help they need because most times they are in denial. So it's called smiling depression because people that have the depressive symptoms, they don't look like they have it. People that have depression, but they don't appear to others around, the people around them, their family members, the society, they don't appear like they have depression. So they look okay outwardly, but inwardly they are struggling. They are not doing well. You know, their mental health is affected greatly because of the depression. All right. So that's what is called smiling depression. Smiling because, yes, you are depressed and you're still smiling. You're okay. You look okay. Everybody say, oh, it's fine. You have a good family. Your kids are doing well. Oh, you're very wealthy. Your business is growing. But you know what you're going through within you. And everybody is everybody think you're fine, but you know you're not fine. And I know a lot of people have gone through that. I mean, I know doctors, professionals, business owners, entrepreneurs, celebrities, people, of high societal status or high social classes, people that are very wealthy, or people that you expect to be okay. They seem okay. They seem good. They seem perfect. They are the ones that usually suffer from this smiling depression, because I think it's because what people expect from them, or the expectation they place on themselves as well. Like, okay, I am like this, I ain't supposed to have depression. It's as if depression is something that you choose to have. And I'm like, no, you can't choose to have depression. As a matter of fact, depression is not a choice. It's just like having diabetes or hypertension or any other physical illness. Nobody chooses that. So you cannot choose to be depressed. So that the fact that you have everything going well for you does not exclude or exempt you from having depressive disorder. Let me say that again, that everything seems perfect, okay for you. You're doing well in your business. You're doing well. You're very wealthy. Everything is fine. It's seemingly fine for you, right? Does not exclude or exempt you from having depression. And that's one reason why people think, oh, I'm fine. And they don't want to own up to the symptoms they are going through. And that's why we have people with smiling depression. So they end up masking their symptoms. They're in denial, so if I may say. They keep their depressive symptom as secrets. They don't want people to know. I'm fine. I'm very well. I'm doing good. And these people, if I may say, I might call it high functioning depression. I've known of doctors that do experience it a lot. Like, okay, even psychiatrists, because it would be like, oh, I'm a psychiatrist. I shouldn't have mental health disorder. Why should I have mental? I'm a psychiatrist. I'm supposed to be taking care of people. Why would I come down with with depression? But it doesn't work that way. Mental illness is no respecter of persons. Like, no one is immune to it. That you're a doctor, or you're a psychiatrist, or you're a therapist, a psychologist does not exempt you from coming down with any mental health disorder. So that's what smiling depression is all about. I don't know if I'm making sense. Does that resonate with you? Does that make sense to you? Have you ever experienced that before, or you know someone that you think might be experiencing smiling depression? Please put it in the comment box. Let me know that you're following me. Let me know that you're following me. Okay, so like I said, I think this smiling depression is something so common in people of high social classes, social status, people that are very wealthy, very rich, celebrities, people of royal background or royalty, people that are professionals. Say professionals, entrepreneurs, doctors, lawyers, and all of those. It's also commoner in males, I think, because of course, I think it's understandable. Females are more likely to have depression than males. That one is there. But when talking about smiling depression, because of that culture of encouraging men to man up, asking them to, you can't cry as a man. You should be strong enough. You should be able to cope. You are strong. So most times they don't want to, own up to their mental health disorders. I remember, during my my years of training as a resident doctor, I come across patients with, male patient with depression. It's very different. The way they present is different from the way a female patient would present. So you won't even see the classical doll face in them. They look okay. They look okay. They'll tell you, I'm fine. But, by the time you start digging deep and asking them questions, how they are doing at their work, how they are functioning at home, and a lot of things, that's when you are able to find out. In fact, sometimes they come down with psychotic symptoms before you can actually know they won't get the help they need early enough. won't get it, and they wait until the symptoms has gotten worse, and they start manifesting some psychotic symptoms before they present. So yes, it can be commoner in males than females. And I remember a movie that I watched whereby a male, was hiding depressive symptoms. He had suicidal thoughts. He had all classical symptoms of depression, but he was hiding that from his family, from his wife, from his children, from his, his boss and all of that. He actually wanted to take his own life, ran into a moving car by himself, but he came to the hospital and was still hiding, saying he had an accident. But thank God the doctor were very sensitive. They paid attention that there's no way that this would have been an accident. It looked as if you actually ran into that moving car. And by the time they now sat with him, they were patient with him. They were able to realize that, he has depressive symptoms. And now he broke down in tears and all. So my point is that smiling depression is real. Many people are suffering in silence. They don't want to say it. And I'm going to move on to the reasons why people have smiling depression. The reason why we have smiling depression in our society. Why a lot of people would rather keep quiet and bottle their feelings and not come out to say anything. One of the reasons I think is because of the shame and the embarrassment that is associated with mental health disorder. Thankfully, things are getting better, I believe. People are becoming more aware of mental health disorder, of mental health. They understand that it's treatable and all. But the truth is that the discrimination is still there. The stigma is still there. People are still, being stigmatized, the discrimination against people with mental health is still there. And people would rather keep it to themselves, like, I don't have any mental health struggle. Especially in Africa. It's really bad in Nigeria, in Africa. It's really so bad that people would rather, go to churches or, religious organizations to tell their religious leaders what they're going through, rather than come to the hospital. In fact, many people would rather go to a physical health doctor. So they will go to their general hospitals or their GP to tell them they have physical symptoms than to explain that I'm actually feeling sad. Perhaps it's because of the shame. Sometimes people think having depression is a sign of weakness. Does that mean I'm lazy? So that means I'm not strong enough. So that I have low energy. I don't have interest. It means that I'm not strong. I am very weak. And because of that, people would rather stay and be by themselves or, keep it to themselves because of the shame and the embarrassment. Does that make sense? Please let me know. If it makes sense, put it in the comment box. Let me know. Another reason why some people would prefer to keep their depressive symptoms to themselves and hide it from others is because they're in denial. The God forbid gang. Nobody wants mental health disorder. So people are quick to say, God forbid, it's not my portion. I reject it. But the truth is that no one is immune to mental health disorder. Anyone can have mental health disorder. And like I said when I started this live, it is not the end of the world. That you have a mental health disorder does not mean that that's the end of the world for you. Does not mean that you can't get the help you need. It doesn't even make you less of a person. Come on. Mental health disorder is the same as having physical health disorder. The brain is a part of your body. Just like the heart is a part of your body. Both of them are organs in your body. So when you have disorders that affect your heart, it's okay to come out and say it. I'm having palpitations, I'm having chest pain and all of that. But when you now have a disorder that affects your brain, then it becomes a taboo. I can't say it. Why? This culture of shaming people or stigmatizing people with mental health disorder, must stop. Because it's okay to have mental health disorder. It's okay to come. We should stop being in denial. Come out and say it. I am depressed. I'm feeling low in myself. I need an assessment. And that's one of the reasons why people won't come out to ask for the help they need. So that makes the second reason why people have smiling depression. The third one is fear. Fear. So people have, fear of being a burden to their relatives. Like, okay, now that I have this depression now, does that mean that I won't be able to walk? And then because of that, my family would have to bear with me, would have to carry the burden of taking care of me. I don't want to bother anyone. I don't want to stress anyone. But hey, have you even asked them? This is fear of the unknown. You've not even asked for the help. Before you start saying that, oh, this is, you're afraid, you don't want people to feel you're like a burden and all, start, at least ask first. So sometimes I try to encourage people, and I try to talk to my clients when they feel this way, that they should put themselves they should have like a reverse of the situation. Say for instance, you are the one feeling okay, and your family member is not feeling well, has depressive symptoms. Would you say that person is a burden to you? Would you say that? So if you wouldn't say that, why are you thinking you're going to be a burden to someone else? So I think we're just quick to judge ourselves. We're just quick to conclude and, have this fear of uncertainties. You're not so sure. I am sure that there are a lot of people that will be willing to support you, even if you have mental health disorder. Your job, your boss is willing to support you. Even if your boss is not going to support you, there are other people that will definitely support you. And if no one supports you, this is your health, this is your life we're talking about. It's better to get the help you need and, go through it by yourself if no one would support you. And once you're back on your feet, you're able to continue to live your life the way you want. So fear, people have fear of being a burden, fear of what people would say. Me that I'm this, I'm that. How can I come down with depression? Fear of what the opinion of others. That's one of the reasons why people don't come out to say they need help. And I'm like, is it when anything happens to you, if something bad happens to you, what would you, nobody would care anymore. Nobody would care anymore. It's your life we're talking about here. And you should not be concerned about people's opinion of you. You should not be, that it does not even matter. It should not even matter, because it's your health that is important. Get the help you need. Stop being afraid of people's opinion. It's your health that matters now. All right? People also are afraid they might lose their job. I understand, because, of course, I know there is a lot of organizations supporting people with mental health disorder. I am aware in Nigeria right now, we're still struggling to get the right support for people with mental health disorder. But I know there are a lot of NGOs that support people with mental health disorder, and I know it shouldn't be that bad. Yes, you might be. Some people would. I've heard of people who have lost their job because of mental health issues, but we cannot overgeneralize. We cannot say it happens to everyone. You can always get the support you need. So, but I like to encourage people to get the help they need first. Get the help you need first before you jump into the conclusion of, oh, I'm going to lose my job, I'm going to lose my relationship, my partner might not like me again. My point is that even if you don't get the help, whether you like it or not, you will eventually lose that job. You will lose the job, because depression is the leading cause of disability worldwide. If you don't get treated early enough, you may not be able to function well. All right? Yeah, fantastic. Discrimination based on disability. You will not be able to function well. I know people that have depression, and they don't have to just, go off work for a very long time. If you get the help you need early enough, you just need to, perhaps be on medication and continue your therapy for a while. You're back to work. Rather than leave the symptoms on you and think you will get better without any treatment. It makes it worse. So it gets worse. And then when it gets worse, then you are unable to function. You become more disabled. The disability gets worse. So that's what it means. So my point here is that let's get off the fear of being a burden, the fear of what people would say, the fear of losing a job, losing a friend, losing a partner. Come on, get that one off and get the help you need. Depression is real, but it is treatable. It is treatable. Okay, another reason why some people would not come out to say they have depressive symptom is that they have guilt. All right, so they have this guilt feeling. Yes, one of the symptoms of depression is guilt feeling. You have excessive guilt. And then imagine now thinking that, oh, I have a good job, I have a family, I'm very wealthy, I'm okay. Why should I be depressed? So they start blaming themselves for the depressive symptoms. I'm like, well, it's not your fault. Depression is nobody's fault. Why should I be depressed? People with depression, with smiley depression, start thinking that, oh, why should I be depressed? Does that mean I'm not grateful enough? I'm an ingrate? Am I not being, working hard enough or something? They start having those kind of negative or distorted thinking pattern. We call them cognitive distortions. So they have distorted thinking pattern that affect the way they view things. So their view or their perspective about situation, about events is distorted. So with this excessive guilt, they have this negative thinking pattern. They don't want to come out. I'm okay, so that means I'm an ingrate. I'm fine, I have money. These people that have that don't have enough money, or things are not okay with them, that are usually supposed to be depressed. But I'm here to say it's not right. It is not true. Depression can happen to anyone, regardless of your background, of the wealth you have, of how things are going, the economy, and whatever it is. So it can happen to the rich or the poor. It can happen to the learned or the people that have no education, whether you have education or not. It can happen to anyone, whether male or female. You have kids, you don't have kids. It is no respecter of persons. So it can happen to anyone. So another point that I'm going to raise now about the reasons why people come down with smiling depression is because we have this picture perfect lifestyle on the social media. I like to talk about social media because I know how this social media has affected and impacted our health, our mental health especially. It has a negative impact on most people's mental health because we get carried away easily by the pictures or the life a lot of people are portraying on the social media. So perhaps we are quick to forget that no one will come out to say this is what I'm struggling with. Only a few people actually do that. Only a few people are vulnerable enough to come out to say this is actually me. This is what I'm going through. Things are not as good as what you think. So because of that, you think everyone is fine but you. Why should I be depressed? Everyone is fine. The unrealistic views of happiness on the social media affects the way you think, and you feel everyone is doing okay but yourself. So you further feel isolated. You don't want to talk about it. So that impacts people with depression's mental well-being. They don't want to come out to say it because they feel, why am I the only one going through this? Everyone seems to be okay. Can't you see this person? She's my friend though, and see what she just posted on her Instagram page, or see what she just posted on Twitter, and blah blah blah. And why am I going through this? So that further, prevents the person from coming out to say I have depression. You want to also feel among, like, okay, I'm fine, nothing is happening to me. But you are doing yourself a disservice if you are not coming out to say that you have a mental health problem. I understand that this might be a very difficult thing for you. I understand that it's not easy for you, but always remember that it is your health we're talking about. It is you. It is all about you. Comparing yourself with others, thinking that you want to please people, you want to have a perfect personnel or perfect lifestyle in front of everyone would not help you. If you're going through something, you're going through it, and you have to just face it and get the help you need. So yeah, those are the reasons why some people come with smiling depression. And thank you for everyone that has been commenting. I could see the Simon said discrimination based on disability. Great information. Thank you. So if this makes sense to you, if this is making sense, or you're getting any insight from this, put in the comment box. Let me know that you are following me. I just want to be sure you are following me. So put it in the comments, say you are following, I'm following. And if you have any question, put it in the comment box as well. So if you're watching the replay and you have questions, just drop in the comment box, and I'm more than happy to answer your questions. All right, so now let's talk about, of course, I've mentioned the signs and symptoms of depression. I believe we all know that anyways. Most of us know that. But just for the purpose of this, I'll just mention briefly. People with depressive disorder usually come down with symptoms like low mood, loss of interest, and reduced energy. So those are the three major symptoms. Major symptoms they have: low mood, loss of interest, and reduced energy. And then the other minor symptoms that usually happen or usually occur in depression is feeling worthless. So feelings of worthlessness, feeling hopeless about the future, about the situation, having poor concentration. They're not able to concentrate. They're easily distracted. They have excessive guilt, and because of this, they might become suicidal. So they have suicidal ideation and all of that. Then their sleep is affected. They have poor sleep, poor appetite, they lose weight. But let me say something. For some people with atypical depression, the reverse is the case. So in terms of their sleep, so people with atypical depression, as the name implies, it doesn't follow the norm. So they sleep excessively. We call it hypersomnia. So they sleep excessively and they overeat. They eat excessively. So they gain weight. And it even makes it more difficult to make a diagnosis of depression in them. They even tend to have more of smiling depression because they don't even appear to have the depressive symptoms. So if you're saying you're depressed and you're eating, overeating, you're looking okay outwardly, or you're sleeping, oversleeping and all. So it doesn't look like depression. Nobody would even want to believe that you have depression. So that's that for atypical depression. And now I'm just going to talk about how to get the help you need. Treatment. So like I said, depression is treatable. Whether it's atypical depression, normal depression, major depressive disorder, mild or moderate depressive disorder, or is it smiling depression, any category of depression, is it a seasonal affective disorder, whatever it is treatable. And that's the good news, right? It is real, but it is treatable. And I'm here to say it. I have treated patients with depressive disorder. They got better and they are doing well in their various, endeavors. They are doing well at their work, in their family and all. I have seen a lot of cases, and as well as also seen cases of depressive disorder that they didn't get the help they need early, and that prolonged their stay at the hospital. But they got better eventually anyway. So my point here is that depression is treatable. The first thing you need to know is you need to get the person to the source of help, the right source of help. Because many a times people get the help they need from the wrong people. So they don't get to see a psychiatrist early enough and they keep going to different places for treatment. So eventually when they get to see a psychiatrist, it would have prolonged the duration of illness in them. So it's very important to get the right source of help. So if you need my help, you can reach out to me via DM. Like I said, I'm a psychiatrist. And I'm also a psychotherapist. I treat people with mental health disorder, including depression. You can always reach out to me via my DM. You can reach out to me via my DM. You can reach out to me, via my website. You can just send me a DM, and I'm more than happy to help. If you have depression, if you have anxiety, if you have all the symptoms, someone that needs help, come to me, and I'm more than happy to help, or even connect you to the source of help. If you need like a face-to-face consultation, you need admission at the hospital. So back to what I'm saying. It's important for us to connect to the right source of help. We can't be going everywhere. Thank you, Pastor Laurie. I can see Pastor Laurie just joined. Thank you. Okay, so it's very important for us to get the help we need. It's very important for us to get the right help. So not moving from one hospital to the other or from one person to the other, getting the real person that is meant to treat you, a psychiatrist. So, and the treatment is divided into three folds. It could be biological treatment, psychological treatment, and social treatment. All right. So the first thing in talking about biological treatment, that's where you use medications. So we have different antidepressants that you can use. I know that one of the reasons people don't adhere to medication is because they are afraid of the side effects. But I'm here to let you know that we have new medications that keep coming out that would definitely suit you. So if you're afraid of weight gain, there's a medication you can use that will not cause weight gain. If you're afraid of weight loss, there's a medication that you can use that will not cause weight loss. So I'm here to let you know that we have different medications that you could use. But I don't want you to continue to have depressive symptoms and not get the help you need. Don't be afraid that the medication would make things worse for you. I've had people say, the medication will turn you into a zombie. It's not true. All of these are not true. There are medications that you can, in fact, you see people that have been using medication, you won't even know that they have mental health problems. They won't look like zombie or whatever it is a lot of people have been saying out there. Get the help you need. Get the right person that would help you. Get a certified psychiatrist, someone that can make the diagnosis and give you the right treatment you need. Okay, that's that for biological. Then psychological treatment, that's for therapy. In some cases of depressive disorder, so if it is mild, you may not need to use medication. You might just need maybe like psychotherapy for 3 months, for 2 months. It depends on the severity of the symptoms you have, and you won't have to use medication. And it really, really works well. I've had clients that I have done cognitive behavioral therapy for with mindfulness training, depending on their their symptoms. So I just tailor it to suit them and give them the help they need. I give them the therapy and they feel better. All right, so you may not necessarily need all these three treatments, the biological, psychological, social. You might just need psychotherapy depending on the severity of your symptoms. Okay, so do not hesitate to reach out. So I offer biological therapies. I offer biological treatments, rather. I offer psychological treatments as well. I'm talking about the social treatment. It's just from, as the name implies. So if there are some social factors, causing that are the risk or that put you at risk of coming down with depression, or any social factor that has been identified during your assessments, then we need to find solutions to them. That's what the social treatment is all about. Say, for instance, you lost your job, and that's the reason you came down with the depression. Then we need to find a way of getting you another job, or seeing what we can do to help you get another source of income. Because that's a social factor. You just lost your spouse, or you lost a relationship. How do you learn to cope? So you must be able to learn some coping strategies, how to cope with that. And that's why the social treatment is very important. And that's all about the treatment. So again, I said, but must you use medication? You mustn't use medication. Like I said, it depends on the severity of the depression. So if it is a major, or let's say severe depressive disorder with all the three symptoms that I mentioned earlier, you have to use medication. But if it is mild, and that's after assessment, you have to be seen by a psychiatrist and the assessment is made. So if it is mild, then you don't have to go and you don't have to use medication. You can just go for psychotherapy. But when we are given medication, we have to combine with psychotherapy. Studies have shown that combination of pharmacotherapy and psychotherapy is more effective than just using medications alone. All right, does that answer your question? Does that make sense? So now over to us. If you have any other questions, please post them. But before I answer your questions, I also want to say this. I know that we live in a society where it's difficult for people to be connected to the source of help they need. A lot of people around us might be going through a lot. And I, as a psychiatrist, I may not be able to see this person. The doctors in your area might not be able to see this person. So it seems to me like you are the one that is closest to the person that needs the help, that needs that mental health help, that needs to be seen by me or by any psychiatrist. So what it means is that you have to be your brother's keeper. You have to be there to help. You have to be able to know that, oh, this person is not doing well. Pay attention and know this is not you. This is not who you used to be. And then get the person connected to the right source of help. That's how to do it. Because you don't want to wait till this person breaks down and it becomes so obvious. The person becomes psychotic and it becomes obvious that, yes, this is a mental health disorder before you get the help that the person needs, before you get the person the help they need. So my point here is that how can you be of help to people around you, your friend, your colleague, your partner, whoever it is? Remember, I've said this, that no one is immune to mental illness. So it can happen to anyone. So here, I want to just let you know that once you notice that there's a change in the person's behavior, in the way they are thinking, maybe they are irritable, they're not doing well, they're not sleeping well, or they are being isolated, they don't want to see you. So if you notice a change in their behavior anyways, you should be there for them. Check out on them. Go there and check out on them. Let them know that you care. And when you get there, don't be too quick to say anything. Just be there and listen to what they have to say. Even if they are not talking, be patient. Just sit down there and say, okay, I'm just here to help. Whatever it is you need me to do, I am more than happy to do it. So just know that I am here to listen to you. And if the person is not talking about depression, most times people with depression will not even want to say anything. You have to be patient. Don't be in a hurry to, okay, I've come to help you now. You don't want me to help you. You can't say that. It makes it difficult for them to even speak up. So you have to create a safe space enough judgmental space for them to be able to open up to you. Does that make sense? Does that make sense to you? I mean, you have to make them, encourage them and support them. Give them the support they need. Don't be don't be in a hurry, rather. Don't be in a haste to leave. You have to be patient. So if you decide you're going to go out to check on your friend, that you've noticed a change in the way he or she behaves, then you have to be ready to stay with the person for as long as it will take. Say, for instance, okay, yes, I'm okay. I know you don't want to talk now. Maybe I'll come another time. So that's if you have something you want to do. You can do that. So, but don't be in a haste to give them an advice. Don't be in a haste to tell them, oh, go and see a doctor. It seems as if you need to see a doctor. No. It doesn't work that way. It makes it difficult for them. Just be there. Be genuinely there for them. Sit down and listen to what they have to say. Empathize with them. And then you can now start asking them questions. Do you think you need help? Do you want me to get someone to help you? All right. So after you've said that, then you can now connect them to maybe a psychologist, a psychiatrist, or the source of help they need. Sometimes it's difficult to own up to having mental health disorder. Like I said, sometimes some people with mental health disorder might be in denial. They might not have insight into this illness, and it's difficult to get the help they need. So you have to be able to, be diplomatic enough to know how to find your way into their hearts so they can trust you and be willing to, get the help you are willing to offer them. All right. Does that make sense? Then make sure you follow up. Yes, you have connected. Yes, you have tried your best, but it's okay to follow up as well. Follow up on them. I hope you're doing well. I hope you're using your medication. Do you need me? Do you want me to come and help you to do some stuff and all of that? So that's the person knows that you actually truly care about them, and the person can trust you. Okay. So yeah. I don't know if we have questions, if we have comments, if you have anything we want to ask me. This is the time to ask the question. If you're just joining, I've been talking for almost an hour now, and I've been talking about smiling depression. I've talked about the treatments, the symptoms, the treatments, and how to connect people who have depression or any type of depression to the source of help they need. All right. And I'm more than happy to help. Reach out to me. If you know someone that has mental health disorder that needs help, reach out to me via my DM. Or if you are the one that you're going through some things that you're not quite sure, I offer clarity sessions for mental health assessments, just to know whether you've got this or you don't have it. Instead of going to Google to check, it's best to get first-hand information from a professional. So reach out to me, book your session with me. I'm more than happy to go to have this assessment done for you and let you know what it is for real, okay? But before we go, if you have questions, let me know. I just want to say this, I don't know, because I'm more of a I like to talk about prevention. I believe prevention is better than cure. And I would like to just quickly share with us things that you can do to make sure that you're protecting your mental well-being. What are the things you can do? I'm not saying this thing will definitely prevent depression, because I can't say that. It doesn't mean that it will prevent depression. It just means that it's going to improve your quality of life. It's going to help you become mentally strong and mentally stable. Even if you have depression, you can still do some of these things and continue to do it. It just means that you're prolonging your life, meaning that you're increasing the quality of your life. You're able to function better when you do some of these things. So the first thing I want to say is that you need to prioritize self-care. All right, you need to prioritize self-care. I mean, I cannot overemphasize. It cannot be overemphasized. If you know me, you know that I'm an advocate of self-care. You have to ensure that you incorporate self-care into your everyday life. Make sure that you take care of your spirit, your soul, your body. Make sure you eat healthy diet. Avoid taking junks, processed foods, and all of those. Make sure that you're taking veggies, protein, balanced diet, adequate fluids, Drink water, 2 liters to 3 liters per day. It's very important. Get your brain hydrated. Your brain needs water to function well. Make sure you take enough water. I mean, you can make it like if you find it difficult to drink water, I'd advise you drink water before your meals. That can help, because if you wait till after your meal, you might not want to take water. So drink a glass of water or 2 before you take your meals. All right. Then ensure that you sleep well. Adequate sleep. It's very important for your brain health. It's very important for your mental well-being. Make sure you sleep well. As an adult, we need about 7 to 8 hours of sleep to function well. So what sleep does is that it restores our energy. It regulates our emotions. It helps consolidate our memory. It improves our cognitive ability, man. Sleep is fantastic. Is like a blessing from above. Thank you, Chinwe. God value. Yeah, thank you. Make sure you're following me at talkmental.health. If you got value from this live session, make sure you follow me and share my content. Share this video. Share it with your friends. Share it to your friends. Let them know that there is value at talkmental.health. So back to what I'm saying. Make sure you sleep well. Sleep is very good for you. It's the gift that God has given to us. Make sure you sleep well. Another thing, exercise. I'm not saying go to the gym and start exercising. Move your body. Walk, take a stroll, increase oxygenation of your brain. Your brain needs oxygen to function well. So if you're sitting, you're at work, you keep sitting down and doing everything, on a spot, then you will not get enough energy or the oxygen that your brain needs to work well. Get up, move your body, take a stroll, 10 to 15 minutes and all of those. Very important. Food supplements. Guys, we need to take food supplements. Sometimes while preparing our food, some of the nutrients get lost through the processing of the food. So we need to take supplements. Omega H3, vitamin D, vitamin E, vitamin C. All of these supplements are good. Please make sure you are taking supplements. Very, very good for your brain and for your mental well-being. Speak to someone. Therapy is for everyone. It is not until you have a mental health disorder that you need to wait, to get the therapy you need. You have to ensure you schedule therapy sessions every now and again, perhaps once in a year or once in 6 months. Just get checked by a specialist, a therapist, a psychiatrist. Get a mental health check. Just like you do your go for your dental appointment to see your dentist every once in 6 months, or you see your GP or your doctor for checkup. Go for your brain checkup. Do that. It's very important for your mental well-being. Another thing is you have to do mindful journaling, mindful breathing, practice mindfulness. It helps get your mind off autopilot mode. So you're very busy with a lot of things. You keep thinking, your mind is racing and doing a lot of activity. Your brain needs the break. So you use mindfulness to keep your brain in the present mood. So you're not worried about what is to come or things that are in the past. You put yourself in the present. So mindfulness is powerful. And the last thing I'm going to say today is that be gentle on you. Practice self-compassion. Many a times we are too quick to condemn ourselves, like, oh, I'm this, I'm not doing well, I'm that. Oh, Dr. Adeola said this and that. As you can see, I'm not even helping myself. Don't rush the process. Be gentle on you. Things get better with time. So take it easy on yourself. Move on. Take it like a stepwise. Just check it. If you're doing better than you used to do before, then you've made some progress. Celebrate yourself for doing that. Don't be too quick to judge yourself. And I have come to the end of today's live session. If you're just joining, thank you, but you have to go back and watch the replay. It's very important that you go back and watch the replay. And for everyone that has said thanks for sharing, they got value, I need you to go. Once I put this live session on my IGTV, I need you to go and put the feedback on my comment section. Let people know that there is a lot of value on this live and they need to actually watch it so they can have better mental well-being. So any other question, guys? If you have questions, let me know. If not, I have come to the end of today's session. I really appreciate you for joining. And thank you for those that followed me. I am more than happy. I am very, very excited. If you have questions, I will definitely answer your questions. Now, if not, I'm going to say bye to you. All right? Okay. I believe there are no questions. But if I'm going to go off now and you have questions, perhaps you're watching the replay, please put in the comment box. I'm going to answer them. So take care of you. Do not don't forget to be intentional about your mental health and reach out to me if you need my help. Bye. Thank you. Thank you, Chinwe. Thank you, everyone, for joining. I'm really, really happy that you all joined me, and it was a very interactive session. Thanks. Bye.